Difficult to talk about, but when it comes to fertility, it's often a factor. A woman's age. In the final part of our series on infertility, we take a look at how age impacts a woman's ability to have kids and some of the latest medical developments that could make it easier for older women in the future.
A little pressure.
Aging. It tends to be a taboo subject, but when it comes to infertility, it's one that has to be brought up.
Here it is. The inevitable biology of aging. I mean, when fertility falls, and once you get out of your 20s, fertility starts falling significantly, and at age 40 it falls like a rock.
Despite biology, many women are waiting longer to have kids. According to the Centers for Disease Control, 20% of women in the U.S. now have their first child after age 35, and about 1/3 of those women have fertility problems. Generally, doctors recommend seeing a specialist if you've tried for a year without getting pregnant, but if you're 35 or older, they say only wait up to 6 months. However, when it comes to age, new advances in medical technology could be a game changer.
The ability to freeze eggs really changes a lot. It's a whole new world now.
Doctors have been able to freeze sperm for decades. Eggs were much more difficult, but a new process called vitrification makes it possible.
Theoretically, a woman could come in here at any time and say, you know, I'm 22 years old, I want to freeze a bunch of eggs because I plan on going to professional school and I don't want to start for another 10, 15 years.
Dr. Gil Wilshire says just because you can freeze your eggs doesn't mean you should. It's still a new and emerging medical technology, and it's an expensive procedure. The University of Southern California Fertility Center estimates it costs about $10,000 to harvest and freeze the eggs, about $500 a year to store them, and another $5,000 to later thaw and use them. And remember, it's only a chance at a child.
There's no guarantees. The only guarantee we can make here is that we'll do our best.
Still, the chances are better today than they've ever been. Some companies, mainly in Silicon Valley, now offer to pay for the cost of egg freezing. It's not common, but you could see more of it in the future. Another group that can really benefit from egg freezing are young women diagnosed with cancer. Now they can undergo chemo or radiation treatments that would have killed their eggs and still be able to have children later on. If you'd like to see the rest of our series on infertility, you can find those stories on our website, KOMU.com.